According to the American Heart Association, in 50% of men and 64% of women, death is the first symptom of heart disease. The arteriovision CIMT test helps to non-invasively detect and treat heart disease and stroke. It is a safe, painless, accurate, and inexpensive ultrasound imaging test that measures the thickness of the first two layers of the carotid artery. The following quote was made by Michael D. Griffin, Administrator of the National Aeronautics and Space Administration. Gary Thompson, an athletic 50-year-old man with a family history of heart disease, was given a clean bill of health after a series of tests with several doctors. Shortly thereafter, he had a heart attack while running a marathon. He survived and subsequently heard of a new ultrasound imaging technology derived from algorithms used to process images of Mars at NASA's Jet Propulsion Laboratory. He was diagnosed correctly with this new technology, something all the other tests had failed to do. He was so impressed, he started a company, Medical Technologies International Incorporated, to make this new technology more widely available. It is now in use across the country.
So I began a quest and to try and find out what was out there that might be a better device to identify people at risk and help treat them as well. I went down to the university hospital where they were holding clinical trials and beta site tests of the procedure. I had the procedure, just loosened my tie, and in 15 to 20 minutes the technician said, "You need to see the doctor right away." And by the way, I did not tell them I had a history of heart disease in the family, nor that I had had a heart attack. And sure enough, they predicted what all of the other tests failed to even say I had a problem with.
As a result of NASA's Innovative Partnership Program, we've been able to transfer this technology to Medical Technologies International. And after a lot of hard work on their part, they've created this commercial medical technology that we can all use to improve our health.
This imaging technology was first used by NASA to process images of Mars. And now, the nonprofit Space Foundation has selected Medical Technologies International and Arteriovision to the Space Technology Hall of Fame. This prestigious award is given to MTI for its successful development and commercialization of arteriovision as an outstanding example of applying space technology for the betterment of life on Earth.
The physician can use it to suggest changes in your lifestyle, changes in your diet and medication, and you have something to base that on, and you have a way to come back a year later and see if it's helped or not. So that's a very valuable tool.
This is the way of the future, period. I mean, there's no two ways about it. This is the cutting edge technology. This is the future on how we're going to look at individuals, determine their risk. With therapies we're going to utilize to reduce their risk. It's also the intervention that we're going to use, or the tool that we're going to use to follow intervention. So it gives us this complete view of one's arterial system, because it does reflect what's going on throughout the body and all the vessels. Different populations, men and women, those with and without heart disease, this is highly predictable of both heart attack and stroke.
And for those patients with heart disease, the arteriovision CIMT test helps your doctor to measure and monitor atherosclerosis, the underlying cause of heart attack and stroke.
Typically what I have is, I have a group of patients that have known heart disease and they're already under the guidance of cardiologists. One of my big groups is the 50 to 60-year-olds that have either a family history of heart disease or have other identifiable risk factors, diabetes, hypertension, and trying to see what risk they are for future heart disease. Now it's very interesting in that someone can come into my office, schedule an appointment, have that done, and they actually walk out with a knowledge of what they are dealing with. And in fact, I can usually talk to them before they leave. It's really nice to, on paper, be able to show someone that there is a little risk here, that your vascular age is beyond your chronologic age. With CIMT, what's happened is it's user-friendly. They're easy to do. They're ultrasound. They take maybe 15, 20 minutes oftentimes in our office.
My family history is one that my dad had a heart attack at 57 and eventually had open heart surgery. So I was thinking my genetic background might not be so good. But I've been working very hard to watch my diet and exercise. And so this was this was really great. This technology is fantastic because it allows me to see the early stages of possible heart disease. And it didn't hurt. It was easy. It's really is wonderful, isn't it? To think about the technology maybe that's used completely in a different area of science, brought into this science, and for the average person to come in and in an affordable way to really get a great diagnosis and give a person an opportunity to see inside the artery there, which is amazing. And then look at the incipient stages of this, and then have your physician say, okay, here's what we can do to attack this problem. We want to be proactive in getting after this disease early. It's great. You know, I wish my dad would have had the same opportunities. And I know down the road, as technology increases, hopefully my children will have this and even more, but this is a great place to start.
Talk to your doctor today about having an arteriovision CIMT test if you have any of the following risk factors for heart disease and stroke. Or if you want to manage your existing heart disease. Currently, the arteriovision CIMT test is being made available across the country and in the near future overseas. MTI is continuing to push this life-saving technology and is rapidly expanding its sales force in an effort to live up to its company credo, making a positive difference every day.